Good morning, Dr. Mohamed.
Good morning, Dr. Akram.
Thank you very much for coming to the All Pulp No Fiction podcast.
You're welcome.
I just heard your lecture, and honestly, it's very nice to hear that we're up to date, with technologies that are just coming out. But before we get into that, can you please introduce yourself to us and to everyone that is listening?
Yeah, so I am Mohamed Shabayek. I am an assistant professor of operative dentistry and cardiology, University of Maryland School of Dentistry. I studied and graduated from Cairo University in Egypt, and I worked in several universities in more than one country. So I have more or less a global experience, more or less global experience. Yeah.
Nice. Well, today's subject that you discussed was ChatGPT.
Mhm.
A little earlier, I talked with Dr. Hanan Omar about it, and we already touched on a few things. But I would like to discuss with you the specifics that you talked about today and how to direct ChatGPT to make your job easier, better, and make use of the technology. So what's your outtake on the use of ChatGPT in dental education?
So as an educator, okay, I of course I keep on looking for new tools that will make my profession easy or easier, and the learning experience for my students easier as well. As I mentioned in the presentation, that looking on finding the information before the era of the internet was difficult, and the only way or ways to find or to get the information was through academicians, content experts, or just to go to the library and look and dive into textbooks and publications. Those were the only ways to get information.
That was the OG way, basically.
Exactly. And if you go back to history, okay, and this applies everywhere globally, that in order to be a scholar, okay, this would affect your lifestyle. For instance, you have to go to the church if you're living in Europe, okay, so that you can get the science from the churches and monasteries, okay. If you're in the Middle East, maybe you have to be a scholar, okay, in the Islamic religion or something like that.
Yeah.
But of course, now we have all the content, all the textbooks just in our pockets. So getting the information nowadays, after the era of the internet, is not a difficult task at all. With the artificial intelligence, specifically ChatGPTs and similar platforms, it's not only getting the information through typing keywords and looking out for the results. You can look for the information comprehensively, meaning that you can ask ChatGPT which car, okay, among the SUVs available in the US markets, okay, has the least consumption of gas, okay, and you can limit this, okay, that available within the price range of 20 to 30,000. So as you can see, getting the information could be very customized, so you don't have to look to pass by the car dealers or look at the car magazines, okay, to look for the car. It's easy to get the information. Similarly in dentistry, okay, you can find out a solution for a clinical situation, okay, based on just few lines you are going to type as a prompt. But the point is that you need to think critically. You need to test the validity of the information, okay? And you need to look at the information and look what's the evidence behind that, because with regular search engines, okay, you can see that, well, this website or web page belongs to this website, which is a publication of a well-respected journal. But with ChatGPT, you don't have the luxury of looking at the source.
Yeah.
Okay. So this is the challenge, actually, is to test the validity of the information. Okay. I want the educators, and I'm just giving advice to learners as well. Okay. Don't rely on ChatGPT, okay, for making the decision for you. Okay. Yes, it's getting accurate. It's getting integrated with other sources like radiology, lab tests, all this stuff. But again, the decision and the critical thinking should be the human task.
Right. And something that you also mentioned in the lecture is that the way you prompt the question or your prompt, the way you prompt your prompt,
Yeah, they
is
use the
quite
term engineer. Okay,
engineer or
and
prompt
the
engineer.
the term engineer is basically referring to that keep refining your prompt. Okay,
Right.
so you're trying the prompt, then you find, for instance, a gap or a bug. Okay, that you can fix it with further refining. So instead of using the term refining, okay, so it's engineering.
Engineering.
Engineering, yeah.
Right.
So yeah, prompt
It's
engineering
quite
should be a
important.
skill.
Yes.
It's a skill that the educator and the learner should have and should develop in order to get the maximum from the artificial intelligence generated chatbots.
Right. And it kind of really directs the way the conversation goes. And honestly, I've been I wouldn't say avid user, but yeah, I've been using ChatGPT for a while now, and I didn't know that you could actually go that deep with it. Like, kind of have a conversation.
We're still at the very beginning. We are still on the shore.
Right?
Yeah,
Like,
we haven't got deep in the sea yet.
that's what I saw. No, is that you can actually have a kind of conversation with the student and kind of make the complication of the student, the questions become more complicated, and base the answers, refine them according to the answers that the question that the student comes up with. Like, that is a new dimension in dental education, right?
Of course, and but you can see that how it can customize the learning experience. So ChatGPT can keep digging, okay, to explore the knowledge gap for the students, and this is a hectic job for an individual instructor. Okay, imagine if you have a class of 60 and you need to do that for each topic for each students. What about if you have a class of 130? Some dental schools actually the class size is 480. So can you imagine how the ChatGPT can customize the learning process? Okay, and yeah, of course, this is an era. But as you can see on the other side, educators need to modify the assessment tool, need to modify the assignments. Okay, and students should show more professionality dealing with ChatGPT other than writing the essays for them.
Right. And I interviewed Professor Volkswindeke.
Schmandike, yeah.
Like his, I think also a leader in this kind of research. And he always says, like, we as dentists, we have to have the ability to scrutinize this information that comes out of AI. And this is basically what you said. Like, we cannot depend on ChatGPT to give us all the answers,
because simply, the one who wrote, the algorithm, can control your life.
Basically, yeah.
Okay. Yeah. So again, we don't know him. Okay. We are not expecting bad intentions, but maybe a mistake was made. Okay. We don't know. Okay.
Right.
So again, we need to test the validity. We need to use the tool, but not rely 100% on the tool.
And one of the questions that I heard today was how, like, it's something very similar to what we're saying right now, is like, we don't get the references, right? We don't get where this information was, driven from, right? What are like solutions? I don't think, like, I thought of something just while listening, is that can we ask the ChatGPT to reference the sources that it's got this information from? Is that also like a possibility, or like it's not so kind of
well, it's if you even try to do that, okay, this is similar to tracing a spider in the web, in his own web. Okay. You can do that. Okay. But I'm expecting that, similar to Google and Google Scholar, okay, we will soon, I'm expecting to see more chat GPTs that are area or specialty directed. So one for the medical research, or one for the academia in general, okay, where the sources of the database is driven from authentic, evidence-based, database that is reliable. So you are not that worried about the authenticity okay, or the reliability of the source, but still the validity of the information, okay, similar to any other research, that the research itself, maybe the methodology of the research is somehow questionable, okay? But again, this will make your life much easier, okay, when you can trace, okay, or track back, okay, the source, okay, rather than just writing a prompt and you don't know exactly what's the source. And believe it or not, okay, we are talking about medicine in general or dentistry specifically. What if you are asking your question deals with any conflict, political conflict, okay?
Yeah, that's
then what will be the reliability of the information and the sources? So at least with the medical or dentistry, we can see that, well, okay, this sounds scientific, okay, and it should be unbiased. But with other topics, you will see
pretty much so.
Yeah, of course, pretty much of bias and conflicting. Yes.
Right.
Yeah.
Well, thank you very much, Dr. Mohamed. I know you have to catch your flight, so I'm not going to take any more from your time.
Thank you.
Appreciate your time coming here.
Thank you very much. Thank you.
Thank you. Appreciate it.